Hey everyone, welcome back to my channel. Nurse Katherine here. Happy 4th of July weekend. In today's video, I am coming at you with some stories from the bedside. And these aren't just any old stories. These are kind of horror stories from the bedside that I personally have experienced. But before I get started with that, do not forget to subscribe to my channel right now and give this video a big thumbs up. Other than that, let's get started. Alright, so story number 1 comes from when I was working in the emergency room. And guys, this story scared the crap out of me. That's all I know how to say it. I was so scared in this situation. So, story number 1 goes. I was new to the ER and I was not a new nurse, but I was new to working in the emergency room, which meant I was new to giving new medications. There were some medications that I never dealt with before. There were situations that I've never dealt with before. And this story goes, makes me even cringe thinking about it. That because of how I felt at the time. So I had a patient come in with an extremely high heart rate, and I can't remember exactly what they were in there for, but all I know is that I had to give IV Benadryl. Before going to the ER, I never gave IV Benadryl before, and once I gave the IV Benadryl, the patient grabbed their chest, their eyes went huge, and literally does. That was their reaction when I pushed this IV Benadryl. I thought I gave the patient a heart attack. I had no idea what was going on, and I still can feel the emotion of how I felt at the time when that happened. Not sure what that reaction was, because that's not a typical reaction from pushing IV Benadryl, but maybe this patient was just a little bit more sensitive to it. I pushed it slow because it was the first time I was giving it, so I knew I needed to push it at the correct push rate, of course, as you do all meds. But that one was probably one of the scariest moments for me in the emergency room because I thought I did something to the patient. Alright, our second story, and I'm just gonna leave you guys with 2 stories today, 2 horror stories from the bedside. The second story comes at you from when I have transitioned to outpatient nursing. So this story is in outpatient nursing, not ER nursing. So many of you know I have left Pennsylvania and I now live in Atlanta, and I no longer work at the so-and-so bedside. I'm in an infusion center now. So in this infusion center, I can do more skills with IVs than what I was able to do at the bedside in the hospital I was working at. So I am allowed to access fistulas and grafts now to give infusions. So this one has to do with that. This patient came in and I'm new to accessing fistulas and grafts. That was like a no-no. You do not touch that arm when you are in the hospital unless you're a dialysis nurse. That was always what I was taught. So I'm new to fistulas and grafts. So this patient, I had to access the fistula in order to give this patient the medication that I give. So I am accessing it. It was in the very beginning of when I was working at my current job, and I put it in. Great, I'm getting my blood return, everything's going well. Then I start flushing it just with normal saline, and the patient looks at me and says, "I only had 2 beers, officer." I'm telling you, it was like that. And I'm thinking, okay, what is going on? I look at them, I'm like, can you say that again? I didn't know what else to say. I'm like, can you, what? I'm sorry, what did you say? I only had 2 beers, officer. And this patient was talking totally normal before I started flushing this fistula. And then all of a sudden when I started flushing the fistula with normal saline, they started talking like that. I'm like, ring, 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 this patient's having a stroke. You know, that's the ER side of me, of doing all the strokes and stuff that I have seen. So I'm thinking, oh, this patient's having a stroke as I'm flushing their fistula. Did I like throw a blood clot? Like, I don't know. All of these things are going through my mind, and my eyes get huge, bigger than what they already are. My chest gets all red because I got like super nervous because I thought I did something again. And the patient quickly starts laughing because they realized how nerve-wracking that was, and they were just joking. And I looked at that patient, I was like, I thought you were having a stroke. I was ready to do the NIH stroke scale on you, call 911, all of it. This patient was joking, and the patient apologized profusely to me as they were like laughing, of course, because I am laughing at this point. And that probably was like, that's number 2 in my horror stories from the bedside. And I can say I have many more horror stories from the bedside, but those 2 are the ones that stick out the most to me. So if any of you have horror stories from the bedside, please share below. Remember to not violate HIPAA and leave out any personal information about the patient or any identifiable information about the patient you took care of, because I do not want that going on here on my page. So those are my 2 horror stories from the bedside. If you guys have any funny stories just like those, please, or the second one's funny, the first one was not. But if you have any funny stories, please comment below. I love hearing other stories from other nurses, or if patients had played jokes on you, all that kind of stuff. Let me know. Other than that, that is it for today's video. Thank you for tuning in. Have a wonderful 4th of July holiday weekend, and I'll see you in Tuesday's educational video. See ya.